So I mentioned a moment ago this panel of experts in discussion tonight here in North Texas. They were discussing the vaccine and the many questions that people out there, maybe you have even as of tonight. Brooke was listening in on it, so let's bring her in, breaking down all the topics that they discussed this evening. Brooke, what did you hear?
Doug, the North Texas Medical Society Coalition hosted that discussion. They streamed it live on Facebook, and they talked about the history of vaccines and how the creation of this one was so groundbreaking. So let's start with Operation Warp Speed. Dr. Charles Lerner, an infectious disease specialist, explained researchers were able to move quickly because much of the baseline research was already there in vaccines created to treat Ebola, Zika, and viruses like SARS and MERS, which are a different type of coronavirus. He says that saved years of study. The other big component was really getting drug companies making the vaccine so it is ready to roll out.
Instead of starting to manufacture the vaccine once you get FDA approval and taking 6 months to gear up, being able to release vaccine tomorrow.
The group also addressed concerns people have about this specific Pfizer vaccine, which, like the Moderna vaccine, uses something called messenger RNA.
I have patients who ask me, they're worried that somehow this messenger RNA vaccine is going to insert itself somehow and change our own DNA and cause long-term problems.
It can't. And then it's degraded, goes away. This is a downstream product. It can't get into your DNA. There's no way.
And we know the concern is real, Doug. An Associated Press poll out this week shows only about 50% of Americans would get the vaccine right now if given that opportunity.
Yeah, so let's talk about the elephant in the room for a second. A lot of people out there, candidly, are still hesitant. What is the message regarding those people who are hesitant and the potential risks that surround all of this?
Yeah, and Doug, there was a lot of conversation around that. The doctor says, yes, there are risks with any vaccine, but it really boils down to do the benefits outweigh those risks?
If I have to take a risk of 1 in a million to prevent something that's 1 in 100, it doesn't take me very long to make a decision.
The doctors also addressed that study in the UK where some people had severe allergic reactions. Dr. Lerner says, really, that's only something you should think about if your allergies are so bad that you use an EpiPen. Doug?